Hi there. So my name's Emily, and I'm presenting today with Sari. We're recently finished foundation year 2 doctors who've been working at Frimley Park Hospital for the past 2 years. We both became aware of Frimley Healthier Together through Dr. Alex Streeter de Diego, who told us about it in induction, and we were really interested about sort of what it was. We'd never heard of something like this before, and I think from the perspective of a foundation doctor, it's a really useful resource because, pediatrics is often a brand new topic for us. And I think it's really useful to know that what safety netting advice to give parents when we're seeing them, whether that's in the ward, ED, in the GP unit, or on a pediatric assessment unit. So we had a discussion with Alex about sort of safety netting. And there'd been some concerns about safety netting documentation and that there hadn't been a huge amount of it done in the paediatric assessment unit. And obviously it's a really important aspect of paediatric healthcare. So we decided to do an audit to actually find out how many people were safety netting in our department. So obviously in medicine, there's always diagnostic uncertainty, but I think that comes at an even higher level within pediatrics. And that's because kids often present with very common and non-specific symptoms, cough, cold, a bit of a fever, and they do have the potential to deteriorate rapidly after discharge. And one of the key stats that I found really interesting was that in meningitis is actually only diagnosed at first presentation of cases, which means 50% of children who have meningitis do go home and have to come back in. And if you have not safety netted properly, there's a risk that child will not get the care they need in the future. Both NICE and RCPCH have guidelines that cover this. NICE have ones that are specific to meningitis. RCPCH have more of a broader one, which is related to emergency care. And they say that parents and carers should be provided with information on discharge of warning signs, when to seek further care, and that should be actually in an oral and written format, and it actually specifies that it needs the written format. And I think this is the big benefit of where Frimley Healthier Together is so great. So for our audit, we initially took a 2-week period of all the admissions into the paediatric assessment unit. We had a total of 145 patients that were included in our pre-intervention audit. And we looked on EPIC, which is our electronic patient records, to see how many people had documented safety netting. And we were looking where they were documenting the safety netting, whether that was on the notes, the discharge summary, or both. And more specifically, looking actually at the type of safety netting, is that they just said we safety netted, or is it that they gave a bit more information that they handed out a link to a Frimley Healthier Together website, or they gave them a leaflet. So we noted that down too, and we were specifically interested as well as how many people were actually, signposting them to the Frimley Healthier Together resource. And what we found was that practice was inadequate. So only 46.2% of notes contained any safety netting documentation at all. So we thought about how can we improve this, and the way we thought about it is making a default standardized safety netting discharge pro forma, which I'm going to show you now. So this, you can see, is, so before in our hospital there was just a standardized discharge summary, whether that was for an adult or a child going home, but we worked with the analysis to create a pediatric specific one. And most importantly, on the right hand side you'll see a little box which shows the pediatric safety netting given, and you could select from a drop down menu how you did that, whether that was verbal, Frimley Healthier Together, a leaflet, or other information sheet online, or other. And not only does that mean that the patient had a specific documentation written about how they were safe netted, but also prompt the clinician who had seen the child to make sure that they had safety netted, and also prompt them hopefully to use the Frimley Healthier Together resource. So we then, in our post-intervention, we audited another 180 patients from another 2-week period, and Sari is going to talk to you now about the results from that.
Thank you, Emily. So if we look at the, sorry about that. If we look at the right of our poster, so Emily just zoomed in kindly for me. The graph on the left shows us the percentage of patients in our group that had a form of safety netting documented pre and post our intervention. Prior to the intervention, so what the blue bar shows is that 46.2% had some form of documented safety netting, and this increased to 77.2% after our intervention. On the right, in figure 2, this shows a breakdown in the types of safety netting used pre and post intervention, with the bars in green showing those prior to our intervention, and the bars in orange showing the additional percentage use post intervention. The use of standardised written safety netting, so either Frimley Healthier Together or a leaflet, improved significantly, with Frimley Healthier Together use increasing from 6% to 22%, and leaflets being used from 4% to 6% after the intervention. Though this was a significant increase, there was still a significant number of clinicians using non-gold standard methods, either verbal or not specified methods. The orange bar at the bottom of this graph it shows the number of clinicians using the pro forma after this was introduced, which is the one that Emily just showed us. 38.3% of clinicians used this, but that meant that over half were deleting the content of this pro forma, which defeated the objective. So what did we learn? Well, in terms of education of staff, though there were definitely more clinicians using the gold standard written methods of after our education sessions, just over half will continue to use other methods. We think probably due to frequent changeover of staff, particularly juniors, it would be helpful to have brief sessions at inductions for clinicians of all grades to bring practice further in line with RCPCH's gold standard guidance of written safety netting being delivered in addition to verbal safety netting on discharge. So what did we conclude? Well, we thought that the use of a default safety netting on a pro forma on discharge definitely improved practice and documentation, but the uptake wasn't what we'd hoped for. With 61.7% deleting the pro forma, we realised this was highlighting the need for a mandatory method that can't be deleted. Therefore, we proposed that the introduction of a mandatory standardised discharge pro forma, which would include a safety netting drop-down that could not be bypassed, would be a better solution, and hope this recommendation will be taken on board to better patient care and protect our clinicians better. Thank you.
Thanks, guys. Lovely presentation. Question relating to that last comment, going to a mandatory pro forma. Did you get any insights into why people don't provide safety netting on discharge from your PTD?
So really good question. I think it's probably a bit multifactorial in that it was our PAU specifically rather than PCD. And I think one, it's that the more confident you get, you'll verbally safety net really clearly, and you might even give the written leaflet or an access to Frimley Together, but you won't necessarily pop it on a discharge summary. So some clinicians weren't even doing a proper discharge summary. They were just saying patient discharged with this. But that doesn't necessarily mean it wasn't done. It's just saying that the clinician wasn't maybe safety netting themselves. We did notice that juniors in the more junior the include.
Oh, sorry, you cut out a second there.
Oh, sorry. I was just going to say we did notice that the more junior members of staff were more likely to safety net. This is probably also due to the volume of staff that registrars are seeing and just how quickly they're expected to get through patients.
Yeah, I agree. No, brilliant, really brilliant. That safety netting super important, as it's shown by that meningitis statistic. So great work, the pair of you.